It's Friday, September 3rd, and the time for your Barbados Today morning news update. The decision for students not to return to the classroom for the new school term will have a huge impact on the privately owned public service vehicle sector in Barbados. That's according to Chairman of the Alliance Owners of Public Transport, Roy Raphael, who told Barbados Today that PSV operators are currently struggling and were eagerly looking forward to school children returning to the physical classroom to help bolster earnings. He said government may need to rescue the sector, given that the situation had been compounded by fuel increases. Raphael also raised concerns about what he described as pirates infiltrating the sector and putting commuters at risk.
We are watching this situation very, very carefully. And this is the number of pirates that are creeping into the system right now, right? The law states that any vehicle that carry 14 passengers or so should go into the terminal and be sanitized. We have a number of pirates out there who run the road daily with people's lives, right? We don't know who they are. If there were any COVID cases in that vehicle, we can't tell. There's no form of tracing. We are saying to these people that they are breaking the law, right? Breaking the law. So I would like the operator, the transport authority, and those persons to look into that, right? Because you cannot carry 14 persons in the vehicle and have it AC, air conditions against your law. Right? What should to happen is that the transport board and the transport authority need to put more routes, more buses on these routes, so that they can carry the 25% of persons that get left behind. But obviously, as you know, if I want to get to work, he will take anything that comes his way, right? But he's putting himself at risk, especially at this time.
The Pan American Health Organization is urging countries to let public health and not politics guide the COVID-19 pandemic response. The organization's director, Dr. Carissa Etienne, said with vaccines remaining limited, countries should prioritize doses for the most vulnerable, like the elderly, health workers, and those living with pre-existing conditions.
Too many of these vulnerable groups have yet to be vaccinated, even as vaccination campaigns are reaching others who are less at risk. So we continue to urge countries to follow the science, both by designing campaigns that protect the most vulnerable and by applying public health measures that can bring down transmission. And finally, we need countries to ensure that vaccines are in arms as soon as they arrive. While countries are administering doses quickly, this is just the beginning. As they receive more and larger shipments, countries must ensure the logistics systems can absorb those doses and that the cold chain is assured all along the way. It also means hiring and training more health workers to deliver these vaccines and organizing communication campaigns so people have all the information that they need so they know when and where to get vaccinated.
Dr. Etienne revealed that PAHO was working with countries to overcome one of the biggest hurdles of COVID-19 vaccinations, which she said were syringes.
PAHO's revolving fund has secured 80 million syringes this year, and we are working with countries to monitor demand and to ensure that they have enough syringes to administer the COVID-19 vaccines. Our goal is to protect as many people as possible and as quickly as possible with COVID-19 vaccines. And to achieve this, we must work together to maximize the impact of COVID vaccinations and to significantly improve access. PAHO's revolving fund is already pooling demand from countries in Latin America and the Caribbean to secure more doses in the coming months and to address the current gaps.
Residents in Lower Estate St. George are still waiting for relief from the strong odor which emanates from a nearby quarry. Reacting to the stop order issued by the chief town planner on Wednesday, which has ordered the operators at the St. George mine to wrap up by October 26th. Residents are praying that this is the end of the situation. Here's what some residents had to say.
The situation is bad. It's affecting a lot of people in the neighborhood here, especially the old people. You're going to have a lot of kids out here because we have camps and we have a lot of children that live through this gap in the area into the back of here. And they dump right behind there. So I don't know what can be done about it. We talked about it already. I would like something done.
The situation is real horrible. The horrible things that we having right not only in the community of itself, because we have like persons as the wind direction changes. It causes numerous problems right now. Children have respiratory problems and so on, parents and that kind of thing. And really, like, we found out too that government and them, like town and country planning and so on, they main bothering themselves with us and some more.
The noise and the shaking of the quarry got all the back of my wall there dropping off. And they said they will see what happened and nobody ain't come back to me.
So you think that with this latest order that it will make any difference?
Yeah, I think they will come and see what is going on, you know, and they will help because it is poor people down in there.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, the St. Vincent and the Grenadines government is leaving nothing to chance amid plans of protest action by the Public Service Union come next week. Prime Minister Dr. Rav Gonzalez said his administration has requested 20 nurses from Cuba and other measures should nurses in the country withdraw their services during the industrial action.
We can bring back retired nurses. There's some set nurses who we can redeploy. There are some other persons whom we can hire who are nurses, because remember we have more nurses than that. We train more nurses than the system itself, the state system could employ. And then, of course, I put in a request for 20 Cuban nurses. This is a free and democratic world, you know. You give your notice to the executive, to the Governor General, as required by the Essential Services Act, for your 14 days. That's fine. But don't think I'm going to sit down and don't deal with my responsibility.
And finally, doctors in the U.S. are expressing concern over the surge of COVID-19 cases among children. More in this report from CBS News.
Last week, more than 200,000 new pediatric cases were reported nationwide, more than 5 times higher than a month ago. In Georgia, more than half of the state's record-high 170 outbreaks last week happened in K-12 schools.
We're getting infected from people who are unvaccinated.
Dr. Paul Offit of Children's Hospital of Philadelphia says masks remain the best defense until children under 12 become eligible for a COVID vaccine, which, due to the lengthy approval process, he believes may not happen until the end of the year.
I want to make sure that you have done the studies in the right way, that most importantly show that this vaccine is safe, because you're about to put it into millions of children.
Today, the CDC said new studies show COVID doesn't appear to be more severe in children, but more children are getting sick in communities with lower vaccination rates.
In August 2021, the rate of hospitalization for children was nearly 4 times higher in states with the lowest overall vaccination coverage when compared to states with high overall vaccination coverage.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.